Ironically, a lot of people want facial shaping, and yes, we are Botoxing it.
It is interesting. People are chewing anything to get their masseter bigger.
Oh, and the number one reason my patients fail
realize that you were supposed to put your teeth together.
You shouldn't even actually be pressing your tongue up. What you should do is you should create a vacuum in your mouth.
One simple trick. That's all it is. That's all you need. You want a stronger jawline, better breathing, and this offers both with no surgery or downtime. It's viral on social media. Why did this go viral? And of course, the before and after pictures, they're nothing short of phenomenal. But does it work? How exactly do you do it? And what can you expect? I'll pinpoint the number one reason why it may fail you and why it fails my patients so you can avoid it. At the end of the video, I'll provide you with additional non-surgical solutions should you rather follow a different path. Controversy? Yes. You see, mewing is a facial reconstructing technique that involves keeping your tongue on the roof of your mouth to change your jawline's shape. The supporters, well, they claim that if you mew, you can reshape your face for a more defined chisel jawline. Some even claim that jaw pain, breathing, and orthodontic issues improve. However, like everything on TikTok and social media, there is controversy, and controversy makes what? Money. Look at these videos that praise the practice. One common denominator that I find is that the proponents already have a strong jawline to begin with. I mean, look at this one. And then there's this one. They already look great. So once again, we need to turn to science and real clinical practice with real patients in real life. And what do we find? Well, to explore this, we need to know, where does mewing come from? Understand too that mewing isn't a medical term. It was named after the British orthodontist Dr. John Mew. He popularized the method in the 1970s as part of his alternative orthodontic practice called orthotropics. John Mew's son, Mike Mew, also an orthodontist, continued to promote this technique and is generally now credited for mewing's growth popularity over YouTube and TikTok, all over social media. Why do I get asked about it in my practice? Well, I create jawlines every day using fillers, biostimulators, fat reduction, fat dissolving, and more. And pictures like these show such a profound jawline change that people are like, why get fillers and implants or surgery if this works? So I need to know about it. You see, orthotropics as a practice uses facial and oral posture exercises and some appliances to change the jawline and face shape. Initially, orthotropics was intended for children to help influence jaw development and straighten teeth for a more aesthetic look. However, the London School of Facial Orthotropics, it's an organization founded and supported by John Mew, now also promotes the practice for adults. Kids are growing and their bones, of course, are able to change shape. But can adults' bones really change? And at what age? Well, it does seem to be around 25. More on that in a moment. But the claim is that human jaws are getting smaller and smaller because of environmental and lifestyle factors, like we're now eating more soft food. We're now mouth breathing more. We no longer need to gnaw on bones like we did thousands of years ago. We now have forks and knives and we eat perfect cuts of meat. Not much gristle, as we do need. We know that for collagen. You see, when bone sees resistance, it grows strong. Just like muscle, when you go to the gym and you work out, it sees resistance, you get larger, stronger muscles. Think masseter in the mouth. How often do I inject here for facial shaping? You put a little bit of Botox here, it shrinks the muscle, but then there's less muscle to pull on the bone. So there's some people concerned that with reduced muscle, you get reduced bone. This certainly has a lot to do with the orthotropics and the ideals and ideas that go with it in terms of building bone, separating the bone, and creating angles and shapes. So Dr. Mew, in effect, says we are all evolving to have these weak jawlines and chins. You know, jawline filler was one of the most popular treatments about a year and a half ago, and it still is. And don't forget, Remember that generation, including myself, where to get the braces we had teeth pulled and then we wore those elastic bands? Well, when those teeth were removed, we changed our jaw shapes. So a lot of us have deficient chins because it was common practice to remove the teeth. Now, as I understand it, they don't pull the teeth so much, but they change jaw shape. Did you have your teeth pulled and braces installed when you were younger? Comment below, let us know. Therefore, as a solution, mewing is supposed to help make the jaw larger and stronger, realign the teeth, and create that more squared jawline. So how do you do it and what is involved? But first, check out the instant before and after here. Without even waiting 10 seconds, you can see the result. You see the trickery here that can be done? On we go. Well, the basics of mewing involves keeping your mouth closed with the tongue touching the roof of the mouth. The lips are pressed together, the top and bottom teeth touching or nearly touching. You'll basically have to train yourself to naturally return to this position, which can take time and practice. There's also suction involved. Let's listen to Dr. Mew describe it.
I'd heard about mewing a long time ago, and I didn't realize that you were supposed to put your teeth together.
You shouldn't even actually be pressing your tongue up. What you should do is you should create a vacuum in your mouth so your tongue stays up. Okay, so now I've got comfortable posture. Comfortable posture when my tongue's down. Then I'm going to swallow my tongue. Swallow several times so I create a vacuum and my tongue is glued on the roof of the mouth with the back third properly engaged.
I will say, I started wearing a soft mouth guard on my lower teeth at night. And the interesting thing, I notice when I wake up or when I think about it, my natural tongue position by wearing that is on the roof of my mouth. And I often think of mewing because of that. I think wearing a soft mouth guard is good so you don't grind your teeth. I'm not particularly a grinder, but I do notice it changes where I put my tongue. Interesting, right? So the gist of mewing ideology is that continuously returning to this posture can help straighten the teeth and improve facial structure. So does mewing work? Here are the facts for you scientists. There's no credible research proving mewing can permanently alter your jaw structure. There's also no evidence mewing can treat health issues like sinusitis or breathing problems, TMJ pain, or sleep apnea. Most of the claims come straight from Dr. John and Mike Mew or this London School of Facial Orthotropics, which are backed by them. Unfortunately, many of the amazing before and after mewing pictures posted online are unreliable since the photo angling and lighting is often deceiving. Check these pics out as examples. The angles are in deceiving positions and they make it look like they work, but it is trickery, maybe not nefarious trickery, but it is positioned to show a better result than probably is there. What do you think about these? There's no question you can get a temporary contour look if you try mewing during a photo session. And this is an old school model trick that's used to tighten the submentum you can see here. Research does support that human jaws are in fact getting smaller. In addition, oral posture or how you position your teeth and tongue has been shown to affect jaw development, but in children. There's a small study of 50 children that did show that those who breathed through their mouth did have minor changes in their facial structures. There's also some studies in monkeys where they stopped them from being able to breathe through their nose, so they had to mouth breathe, and it did change their dentition and their jaw shape. Now, what does the American Association of Orthodontists, the AAO, say? Well, they agree that tongue alignment can change your facial structure. It can change it. How you naturally rest your tongue can also clue in orthodontists on potential mouth issues such as tongue thrusting that moves the teeth forward and can cause bite, speech, or swallowing problems. The AAO warns mewing should not be used to try to change your teeth or jaw line. So what do the orthodontists say? Well, I talked to a few. The orthodontics community is very critical, apparently, of mewing. In fact, one told me that the General Dental Council stripped Dr. John Mew of his dental license for his unconventional practices and criticism of traditional orthodontics. In addition, the British Orthodontic Society expelled Dr. Mike Mew, and the General Dental Council held a misconduct hearing regarding some of his treatments. Now, I'm just reporting this and I don't know the details, so take this for what it's worth. I'm sure the Mews have had a rebuttal on social media. Remember, Dr. Jordan Peterson has his license in jeopardy, and they're asking him to go through social media training, or he risks losing his license.
Now the judges have decided that you're wrong. Maybe you're wrong. And I think, well, I expressed political sentiment and I'm actually informed. For the life of me, I can't see how I'm wrong. I think I have a responsibility to say what I think, and I think many people agree with that, and I think the fundamental consequence of that around the world has been massively beneficial to people.
So just because a licensing body doesn't like the messaging, sometimes it doesn't mean that they are right. From what I can see, this is going to help people, or at least the concept's going to help people before the age of 25 when things are more mobile, at least without appliances. And I don't mean the Jazzerciser. I'm not a fan of that. A lot of people get TMJ or temporomandibular joint pain, and we end up Botoxing them to get rid of that pain, or they're on anti-inflammatories. So that's where you chew something to build the masseter, the Jazzerciser. People chew dog toys, all kinds of stuff to try and build up their masseter muscle. Ironically, a lot of people want facial shaping, and yes, we are Botoxing it to reduce it.
Check out the Jazzerciser here. Now, to me, they all look like they have strong jawlines to begin with, like I was saying. What do you think? It is interesting. People are chewing anything to get their masseter bigger, and I'm reducing them for face shape.
So are there potential risks? It's unlikely the practice will cause any unwanted side effects. Unlike the Jazzerciser, like I mentioned, that can cause that TMJ pain, mewing doesn't have any side effects that I've seen associated with it. But what are some good alternatives to mewing if you don't want jawline surgery and you want minimally invasive? Oh, and the number one reason my patients fail with mewing, they can't maintain it. They say by day 7 to 10, they just can't maintain the thought process of doing it all the time. And part of it is, I think, they're not seeing enough results for their effort. That's the number one reason you see people stop doing something. If they were seeing results quick enough, they would continue doing it. But not enough people see those results, in my opinion. So in clinical practice, Kybella can be used, or PCDC, phosphatidylcholine and deoxycholate combinations, to reduce fat along the jawline. Dermal fillers, of course, have many videos on those. You can think of gels being injected, particularly things like Radius or strong hyaluronic acid fillers. They can also be used in the chin to give that forward projection. Works very well if you don't want an implant. RF, radio frequency microneedling, can be used to tighten and reduce fat. And also things like HIFU or ultrasound treatments can be used to target fat as well as tighten the skin along the jawline. If you don't like temporary, well, permanent fillers like Belafil can be used along the jawline. Did you try mewing? If you've tried mewing, comment below, let me know. And you're now going to want to watch this video up here, all about creating a strong jawline, beauty angles, and one down here on fillers along the jawline so you can keep your skin and body beautiful, healthy, and vibrant.